Well, thank you very much. Good afternoon, everyone, and we want to thank you for tuning into the webinar today. The objectives of this webinar are as follows. Number one, to explain the importance of system preparedness prior to an event or incident. Number two, to discuss the various approaches to gain situational awareness of system readiness and to identify gaps and points of failure in these systems prior to an event or incident, and to review possible solutions to address gaps in system readiness. Oh, good, I got it right. The public health and preparedness and response competencies that we'll discuss in today's presentation in the domain of model leadership include actually two competencies, 1 and 3. 1.1, solving problems under emergency conditions. 1.3, facilitating collaboration with internal and external emergency response partners. And 1.4, maintaining situational awareness. Or competency 3, thanks. In the domain of plan for and improved practice, the competencies include 3.1, contribute expertise to the community hazard vulnerability analysis. 3.2, contribute expertise to the development of emergency plans. And 3.3, participate in improving the organization's capacities, including but not limited to programs, plans, policies, laws, and workforce training. So what is this thing we call vulnerability? According to definitions, there are more than 24 definitions in resource. Part of the problem in defining this term is the question, vulnerability to what? Is it natural hazards, human-caused hazards, or something else? At times when you mention hazard, risk, and vulnerability, people get the mental picture of quote-unquote ghettos, of people of lower socioeconomic status, racial or ethnic distinction. Hazard, risk, and vulnerability go far beyond ghettos, neighborhoods, and are stereotypes of what these things look like. It's important to remember that vulnerability to disasters is not just a lack of wealth, but a complex range of multiple factors, be they physical, economic, political, and social factors, or the predisposition of a community to be damaged by a destabilizing phenomenon, be it natural, human, or some other incident or event. These multiple factors impact both the resilience of individuals and communities, and they align very nicely with the discussion of social determinants of health and the relationship between neighborhood, zip code, and health status. In short, a person's ability to prepare for, respond to, and recover from a disaster is directly related to their vulnerability as previously defined. But this GIS snap is very telling. Pre-existing conditions in the community impact preparedness, response, and recovery activities. Chances are high that disaster response in areas of high poverty will look much different and require very different resources than those disasters that impact more affluent communities. For example, in areas high in poverty, we can communicate with groups to tell us that they should prepare, but they may not have the resources to do so. 3 days of food may be a laudable goal, but if a person is worried as they are trying to secure their next meal, it's an unrealistic one. If the individual or their family live in substandard housing that does not keep the weather out in a rainstorm, chances are it will not do well in a significant storm. We can tell people to evacuate, but if they lack transportation or it's not provided for them, this is a problem. It's important to remember that people who are poor may be fully aware of the risks in a pending disaster, but have fewer alternatives to choose from to implement protective actions. I certainly encourage the listeners to consider the disastrous hurricanes in New Orleans over the past several years. There are several factors that impact vulnerability, and these factors go beyond the hazard or location. Many factors, be they social, political, economic, or environmental, collide on a daily basis. The outcomes of this collision are amplified in the face of a disaster. It's also important to remember that these vulnerabilities are unevenly distributed across individuals households, communities, counties, and regions, one must remember that inequities produce measurable differences between groups before, during, and after a disaster, and shape the experiences the individuals, households, and communities have. As for race and ethnicity, let's first define these terms as best we can. Race is an arbitrary way to organize people based upon easily distinguishable features. Sorry about that, folks. Ethnicity is based on shared cultures such as language, religion, or common norms or practices. In the business, we talk about phenotype versus genotype, essentially knowing that that phenotype is how one looks, genotype is genetic makeup, and we know for sure that there are no genes to define race. So it is a phenomenon of phenotype versus genotype. Ethnicity is based on shared cultures such as language, religion, or common norms or practices. Research has shown measurable differences in how a person prepares for, responds to, and recovers from a disaster, including what resources are available and accessible post-impact. A person's class will drive their access to resources that will make them more or less vulnerable. Class can reflect patterns of occupation, education, ownership, activities and appropriation and distribution of resources, including a person's ability to access social and economic resources post-disaster. Class also impacts political and economic power, modes of consumption, and legal rights. Those of higher social class are more than likely have access to reliable transportation, live in a structure that keeps the weather out, and may have multiple options to when it comes to preparing for, responding to, or recovering from a disaster. Those of a lower socioeconomic class have fewer resources. Much has been discussed lately about the difference between zip code and genetic code, namely how important it is to define where you live as a determinant of your health status and your health outcomes. So there's some things for you to think about. Issues that are present in the community will be present post-disaster and may be made worse by the disaster. Violence, behavioral health issues, abuse, and lack of trust are but a few examples. Knowing the community before the disaster is a very important element in improving a community's ability to prepare for, respond to, and recover from disasters. Community elders and leaders can help you better understand the community far beyond what statistics and reports will tell you. That is, get to know your formal as well as your informal leaders and communities. Also, know the resources that are in the community before the disaster, asset mapping. The vast majority of communities have something they can bring to the table to the disaster to help determine the resources in the community pre-event. Also remember that during a disaster is not the time, and I'll repeat that, during a disaster is not the time to be passing out business cards. Establish your relationships now. It gives me great pleasure to turn the mic over to our next presenter, Dr. Tabler, who will talk about systems assessment.
Okay, this first slide that you see here are the different organizations within a community. And we're representing organizations that provide services to vulnerable populations. The next slide shows that these organizations are connected through a spiderweb pattern and become a system to deliver services to communities, vulnerable populations. These connections are dependent on the relationship organizations within the community have developed over time. The relationships with other organizations are required for the system to achieve its goals of serving the vulnerable population. In Hillsborough County, we decided to do a study of this system, and we decided to use general systems theory. And general system theory looks at individuals, groups, and organizations considered systems and homeostasis. Systems, self-regulating systems, self-correcting through feedback from the environment. Homeostatic control mechanism has three independent components: the receptor, control center, and the effector. The receptor sends signals to the control center once it detects a change of normal levels in the environment. The control center sets and maintains the ideal range within this organization and makes decisions on what to do based on signals from the receptor. The effector makes the changes within the organization, such as increasing workload. Okay, and within the general systems theory, we're using the open systems model. An open system continuously interacts with its environment. Here, organizations are goal-seeking organisms whose structure and systems reach a state of equilibrium between internal climate and external forces. And here is a diagram of that organization, that system. And if you look here, you see the triple circle, which is actually the organizational boundary. The boundaries must be permeable to the external environment for the company to survive, but degree of permeability must be consistently designed and monitored. When borders are too permeable, forces, pressures and demands of external environment can be overwhelming. When the borders have too little permeability, the organization gets cut off from the resources needed to survive and grow. Whoops, sorry about that. Then you look at everything on the outside of that circle is the external environment. The external environment is everything on the outside of the boundary, includes clients, supply system, community norms. And inside that circle, you'll see the organizational climate. That is everything within the organizational boundary. It includes focus, goals, objectives, employees. And within there, you see the strategic view, which is planning, deployment, focus of leadership, resources, policies, and execution, which are where decisions are made. It's the structure, people, process, and information of the system. To the left-hand side, you'll see inputs. An organization must obtain information on the industry trends and the needs of market segments, as well as financial, human, legal, and material resources from the external environment in order to survive and achieve sustainability. The input contributes to the creation of the outputs. The movement through the organizational climate is called transformation. It's where inputs into the organization are transformed by business processes to other forms, such as products and services. And on the right-hand side, you see the output, which are products and services which are exported to the external environment by an organization to meet needs of customers, just fulfilling the organization's purpose of making good on the contract with the external environment. Next, you have results, and the results are feedback that you get from the environment. If you look at the bottom of the page, you'll see strategic feedback. This is an indicator of the degree to which an organization is connected to and monitoring the external environment. It includes business context such as purpose, need, target markets, industry trends, competition, social, culture, and political expectations, and material resources. So this all comes back in as an input. Also, there are tactical feedback, which is the indicator of the degree to which an organization is on course and achieving the goals it committed to in its contract with the external environment. Institutional objectives, goals, customer and employee expectations. This all goes back in. It's a continual cycle trying to reach a homeostatic situation. Okay, pre-impact assessment of organization and interdependencies in the system they operate in is necessary to gain situational awareness of gaps and failure points both at the organizational and systems levels. Points of failure. After identifying the points of failure, mitigation efforts can ensure that the mission-critical resources needed by the system are available post-impact, so organizations can continue to deliver services to vulnerable populations. As I said, in Hillsborough County, we did a pilot study, the Vulnerable Population Task Force, and the study was called Prepare, Respond, and Recover. And this was looking at the organizations serving vulnerable populations. Why study how our system delivers services? This is because of our piecemeal system of delivering social, psychological, and medical services. The governments of many large communities do not have a clear accountability of all the players in this system and their resources. A major part of this issue is the recent proliferation of faith-based organizations, community-based organizations, not-for-profits, and non-government organizations who obtain their funding through a vast array of individual and group philanthropy, as well as grants from city, county, state, federal, and international governments. Systems effectiveness. It is difficult to assess the effectiveness of a system's ability to function after a disaster without having a baseline of how that system functions on a day-to-day basis. The vulnerable groups we identified with the Vulnerable Population Task Force were health, economic, social, and linguistic. We then tried to identify all the service providers in the community. And to do this, we got a list on vulnerable groups that serve vulnerable populations from the Tampa Bay United Way, Hillsborough County Children's Board, Crisis Center of Tampa Bay, and we also did a search on Google to find many small NGOs. Okay, I'm going to go back because I got another insert here. We had the organizations classified by critical service providers, and these are the service providers who must continue providing their services during and after event. The second group was substantial service providers. The inability of these agencies to provide services would have an impact, but absence could be mitigated. And then we also had the supportive service providers, which their operations could be restarted after the critical substantial service providers are up and running. Okay, the survey we developed was reviewed multiple times by members of the Vulnerable Population Task Force until an assessment instrument of 40 questions was developed. Data collected focused on organizational emergency operation protocols, continuity of operations plan and exercises of that plan, and disaster preparedness by organizations and employees. The survey was posted online with SurveyMonkey. Of the 62 organizations contacted, 31 or 50% were responding to the online survey. And here's some of the findings of that survey. As I said, we got 31 responses, and 94% or 29 said that they did have a protocol to operate in an emergency. But only 61% actually had a written continuity of operations plan. And without a written plan, you really can't expect everyone to understand the plan fully. We also asked what was the last time the continuity of operations plan was revisited, when was it rewritten, and we found that about 39%, it had been over 3 years, or 1 to 3 years since they had revisited the plan, which really means that the plan is obsolete. Your plan should be a living, breathing organism which changes with any changes within your organism. You get new equipment, you get new employees, all that needs to go directly into your plan. And then we can see here that many of the organizations, 41% it's been over 3 years since they exercised their plan, and only 4% only 4 of the organizations had actually exercised their plan within the past year. We asked if they conducted disaster drills. Only 30% said yes. So if you're not exercising your plan, you can't expect your employees to be able to do their job in a disaster. Here's a question we asked: if the director knew if the facility was in an evacuation zone. This was a major concern to us, when 30% had no idea whether or not they were located in a disaster zone. And if you look at this, the end here is only 27, so there are 4 organizations who didn't respond to this. Another question we asked was, what winds could the facility handle? We're in a hurricane area here. It's a very major concern to us. And here, 67 or 18 of the 27 organizations had no idea what category storm their facility could take. Then we also got into some questions about the employees. Did they know their role? Only 67% said yes. We wanted to know if the employees were cross-trained. Only about half the organizations responded positively to this. We also asked if the employees were required to have a family plan. And only 3 of the organizations, 11% said yes, they were required to have a plan. And the problem here is, if your employees don't have a plan, and when the catastrophe happens, they're more likely going to be scrambling to take care of their own family and worrying about what's happening at work second. And finally, we asked the director if they themselves had a family plan, and only 65% of the directors had a plan themselves. We found this very, very disturbing. Okay, and here's some other questions that we asked, that we collected data on, is what products are required for your organization to continue providing core services? What is the maximum number of people your organization has the capacity to serve? What organizations send you clients or referrals? What organizations must you interact with in order to provide services? And what organizations do you release your clients to after they receive your services? We're not providing this data because it's so mixed that you really can't identify it in one or two graphs. Okay, I'd like to now hand the mic over to Pat Gardner, who will talk about possible solutions to address gaps in system readiness.
Thank you, Dr. Adewale. As we all know, preparedness and planning before an incident or event increases the likelihood of successful outcomes. One of the challenges related to preparedness is identifying direct and proxy measures to determine the level of preparedness. It's also important to remember that this level of preparedness can change over time. It can be subject to multiple variables that impact the system and its ability to perform in a disaster. One can amass food for use in times of a disaster. Is that prepared? Yes, but to a degree. As a planner, my mind immediately begins to formulate other questions. What about water? What about shelter? How about the sewage that's going to result from the ingestion of the food and water? How is that going to be managed? Different questions begin to formulate in my mind for equipment and supplies. While we can have some impact related to preparedness at the individual level, this impact can be at a level that is less than what we would like it to be. Changing individual behavior can be a challenge, and it would take immense resources to prepare all of the individuals we need for the various disasters we may confront in the future. I think we can all agree that disaster preparedness, response, and recovery is a team effort. That leads to the question, is the team, or in this case the system, ready for the disaster? If not, where are the gaps? To illustrate the components of a gap analysis as it relates to the disaster, let's consider the following. If an analysis is structured like a mathematical equation, the needs, which are in blue on this chart, minus available resources, noted in red, equals the gaps. The needs are a combination of the vulnerabilities plus the situation that the individual or community finds themselves in. The available resources could be both what is currently available in the agency or organization, or if that agency or organization is part of a bigger system, what the system or organization capabilities and capacities are. Capabilities are what an agency or organization can do. Capacity is how much of it they can do. In a disaster, those ongoing partner and system resources can be augmented with additional resources. From the planning perspective, estimates can be made as to what and how much of those resources will be needed in various scenarios. From the emergency management standpoint, pre-scripted action request forms, also known as ARFs, can be developed. This helps the parties involved in the planning process forecast what the needs will be prior to an event or incident and take steps to identify where those resources are and what the mechanisms are to acquire them, so during the event or incident they can be obtained in a more timely fashion. For years, emergency management was described using a phased approach: preparedness, followed by response, followed by recovery, followed by mitigation. In reality, one phase does not always follow the other, and the lines between the phases become blurred. Also, one part of the community can still be in response, while another part of the same community is involved in recovery activities. Another way to look at emergency and disaster management is through functions that occur pre-incident, immediately surrounding an incident, or post-incident. Unfortunately, at the community level, communities cannot prevent many types of disasters that they face. Preparedness can take place before, during, and after an event or incident, as can mitigation. Response takes place immediately before the incident as part of protective actions and can follow through after the event based on the impact. Recovery takes place from when the incident starts and extends out post-incident. For vulnerable populations, individuals and families may have completed or may be in a process of completing some minimal preparedness activities. Most of the time, mitigation activities are few or non-existent in this population. Response is more in the moment and on the spot, with neighbor helping neighbor. Recovery in these communities takes an extended period of time as compared to other communities. As Dr. Troutman had mentioned, there are multiple definitions for the term vulnerable populations. This may include seasonal workers, be they agricultural or in our service industries. Post-disaster internally displaced persons, also known as IDPs, and refugees may be in need of services as well. These populations certainly are vulnerable under multiple definitions of the term. Most communities plan for impacts to their community and its population, but many times IDP and refugee population planning and response takes place at the moment. This happens in many disasters, as was evidenced post-Katrina, as IDPs fled the impacted area to other locations throughout the United States. That said, pre-event planning should also consider situations where the community becomes the host to the IDPs or refugees. In short, you don't have to be impacted by the disaster to feel the effects from it. So, how do we get our arms around this problem? Here's a few things to consider. In disasters, situational awareness is vital. Situational awareness consists of three parts: what's going on, what does it mean, and where is it going? For the what's going on part of situational awareness, use existing or new data sets for vulnerability assessments to support planning. But that leads to a question. Is the vulnerability assessments part of a collaborative effort from multiple agencies and organizations, or is it more focused on what one group or agency considers vulnerable? A quick way to determine this is look at the data sources for the vulnerability assessment. Are they from multiple sources? For completed plans, what agencies and organizations signed off on the plan? If there are multiple signatures from various agencies and organizations, that's a good thing. If not, that may indicate that the plan has not been widely reviewed, and the definition of vulnerable populations used is what one particular agency or organization considers vulnerable. For the what does it mean, what is the data and information telling you? It may be important to bring in technical specialists to help interpret the data and information. Remember that a person's vulnerability within a group or classification can vary widely. An example is that some elderly need round-the-clock medical care, while someone of the same age may be active and not in an institution or health care setting. Consider using geographic information systems, also known as GIS, to graphically illustrate areas in your community that require special consideration for response. Also consider the fact that some people might have multiple conditions or situations that increase their vulnerability. An example would be an over 65-year-old person on oxygen living in a high-rise condo. As you start to layer the different individual vulnerabilities, you may start to see concentrated areas within your community where there is people with multiple vulnerabilities. It's also critical to explicitly plan for high-risk groups. Avoid implied planning for high-risk groups by putting into a vulnerable population group in the plan and having the same approach for all communities. While there may be some common emergency management approaches that can be taken with multiple high-risk groups, such as special needs or functional needs sheltering, There will be some things that have to be considered and planned for carefully, with the approach varying group to group. An example of this would be communication. To reinforce what Dr. Tabler had mentioned in his section, think systems. Here's an example. Access to health care takes availability of services. To be truly available, those services have to have openings where the patient can be seen, plus proximity to the person's location, plus transportation, plus economic ability. Economic ability basically means, is the service free or is there a payment or insurance required? So healthcare services can be reestablished post-disaster by getting that clinic or hospital operational, but are the other components in place so that hospital or clinic can start to receive patients and start to care for them? Having a plan is important, but also considering have a backup plan or two or three. Ideally, the time to contingency plan is before the event, when the scenarios or impacts, the system interventions, and the intended as well as the unintended consequences can be considered in a lower stress environment. The more you have to think about in a disaster or a high stress situation, that is to say, the higher your cognitive load, the higher the chance that you may miss some critical components or steps. So have your primary plan, your plan A, but also start to frame out plans B, C, and D. If you script these prior to an event, they can be modified slightly based on the current situation and then implemented in a shorter time period during the event. Not all organizations or agencies that serve vulnerable populations are created equal. Many emergency management centers use a prioritization methodology when it comes to receiving requests. They tend to fall into one of four categories: life-saving, life-sustaining, infrastructure, or normalization. Resource requests are prioritized and addressed in this order. We use the same approach prioritizing agencies and organizations that serve vulnerable populations. We then considered what is it they needed to maintain their ability to serve their clients. What do they need upstream, so the things coming into the agency to be able to provide the service downstream to the client. This, along with the results of the survey, reinforced the need for the continuity of operations planning, or also known as COOP planning. Having a good plan is a good start. Having a plan that works is even better. So while there are requirements for plans and plans formats, the question is, will the plan work? Basically, is it functional? Said another way, will the plan be of use in a disaster, or is it a compliance plan that meets specific requirements but will be of little use in an event or incident? One example of a functional COOP plan format is on the next several slides. The agency organization determines what their critical functions are. For each critical functions, the following details are then added. How many people, also known as full-time equivalents or FTEs, does it take to perform the specified critical function? What current titles used in the agency organization can be used to provide this critical function? What's the general educational background, knowledge, and certifications required for this person involved in this critical function to accomplish it? What are the specific program training, experience, or certifications that are preferred for the individual who's performing this function? The agency or organization then creates detailed explanation of tasks assigned to this position. This could be in a checklist format to improve the plan's functionality during a disaster. Then applicable statutory, regulatory, or program procedures are referenced or detailed out, along with information system access that's required for this person to be able to do this critical task, as well as any third-party contacts that could be brought in to assist with this critical function. That may be other service providers or retirees. By listing out each critical function this way, documentation that is provided to those performing these critical functions can be short and concise, making it much more functional. The person does not need to worry about the entire disaster plan, just a critical function that they are responsible for or involved in. For functional plans other than COOP plans, I found that the following important elements for the boots on the ground, feet on the street teams are important for providing services to vulnerable populations. First, are we making the correct assumptions? Assumptions are what is thought to be true in the absence of facts. Getting assumptions right is critical. Getting assumptions wrong can have significant negative outcomes. What can we do to improve situational awareness? The what's going on, what does it mean, and where is it going? Having these essential elements of information, also known as EEIs, is important in maintaining situational awareness for planning and decision making. What is our level of intervention as a team? Are we there to observe and assist if needed, help out, or take over the function while the community gets back on its feet? The other specific components that need to be considered and documented are, what is the mission? How long is the mission? And what is the concept of operations? Basically, how are you and the team going to accomplish the mission with the available resources? What are the areas of operation? Where are the muster or staging points? What's the staffing mix of the teams, and how will those teams be organized? What types of shifts will be utilized? 8-hour shifts, 12-hour Alpha Bravo shifts, or will there be 24-hour operations? How will volunteers be used? Volunteers can be a great resource if their skills and energies are managed. What type of planning support will be available? Will it be on-site, or will it be provided remotely? What are the logistics? And finally, what is the demobilization plan? Well, many of these elements can be determined pre-event, while some, like the area of operations or the muster or staging points, will probably need to be added at the time of the incident or the event. Once the plan is written, provide the plan to a small group of individuals. This group is sometimes called the red team, to look for weaknesses in the plan, possible failure points, unclear sections, conflicting components, things that make the plan less likely to succeed. This honest feedback really can strengthen a plan and increase the likelihood that it will work when it needs to. So remember, the red team is trying to help you and your planning team take their findings and improve your plan. When a plan does go out for the review in the field, whether it be to the red team or to a wider audience, consider asking for comments back from the reviewers in the following 4 categories. Execution critical. If it's not fixed, the plan won't work. Substantial. The plan will work as written, but not well unless changes are made to that specific section or element. Supportive. These are things that will improve the effectiveness and efficiency of the plan when it's implemented. And administrative. The spelling, the grammar, punctuation, spacing, and other non-critical corrections. This approach then gives you a prioritized list of what needs to be made for changes related to the plan. In summary, planning for vulnerable populations prior to an event is critical and should be done as part of a multidisciplinary team. Planning should address the root cause of problems where possible, and plans should be a compass for activities related to an event or incident, and they should be flexible. So remember, no plan is perfect. I'll take a good plan now when I need it rather than a great plan that is finished after I need it. Also, plans should be part of the solution, not part of the problem. A plan that is 300 pages long may be comprehensive, but it is not functional in an event or incident. Plans should be functional and follow the KISS principle. Keep it short and keep it simple. Plans should address single points of failure, such as power failure, water interruptions, communication failure, or other failures that have far-reaching impacts if that one element fails. Plans should also be scalable from the minor to the catastrophic. Cognitive load should be reduced where possible by using checklists, memory aids, or other reference tools. It's also important to think about the unintended outcomes and consequences of an action or intervention, as well as the intended outcomes or consequences. While the approach may sound good in theory, its implementation can be complex and problematic and may create other challenges in the disaster. So remember, today's solutions can create tomorrow's problems. As part of the written or plan implementation, be it in an exercise or an actual event, remember the importance of the after-action process. Most after-action activities center around 2 components. First component is called hot wash. Hot wash happens shortly after the event, incident, or exercise, and it's more or less an unfiltered debrief of what worked, what didn't, and what needs to be fixed. Second component of the after-action process is the after-action review meeting or a series of meetings. This usually occurs after the hot wash, and the output of this meeting or meetings is a report and improvement plan. In both the hot wash and the after-action review, 3 types of lessons tend to result from activities. They are lessons learned, lessons observed, and lessons lost. Lessons learned are when we change systems, processes, and plans based on the findings of the after-action process. While we label our experiences post-event or incident as lessons learned, have we really learned them? Lessons observed are when we don't change the system, process, or plans based on the findings of the after-action process, and we observe the same phenomenon again and again. Communication is a good example of a lesson observed, as challenges with communication seem to always be the biggest problem in every disaster. Lessons lost are when problems are not identified, acknowledged, and addressed after a disaster. This results in a high likelihood that these problems will reoccur in future events. In closing, may you not be impacted by disasters. If you are, may those disasters go well, and may all of your lessons be learned. This concludes our prepared presentation. We'd like to start to address your questions now.
Thank you very much, Dr. Troutman, Dr. Tabler, and Mr. Gardner. We now have a few minutes to take questions from our audience. As a reminder, please type your question into the question box in the right corner of the screen. You will open the box by pressing the 2 arrows. We do have a couple of questions that have come in. The first one is, how were the organizations surveyed selected?
What was that again? How were the questions, how were they selected?
How the organizations selected.
Organizations were selected by the members of the Vulnerability Task Force. They decided which organizations were critical to delivering services after a disaster, and those were the organizations that we sent a survey to.
Great, thank you. And could you please explain the next step in your work with organizations serving vulnerable populations?
Again. Well, the next step would be to try and get these organizations who do not have COOP plans to develop one. And we've started doing this. We're working with the Hillsborough County Children's Board, and we're going to address the organizations that they contract with and see if we can't get them to start the development of such plans.
Thank you. See, we have a few coming in right now. One question is, do you know whether any FEMA evacuation plans currently exist to remove our youth from areas where social unrest has or expected to erupt? For example, to reunite college students with their families.
This is Pat Gardner. I do not know if any FEMA plans exist. I know that we have plans as a university through our offices that do the emergency preparedness and response on reunification of families and assisting the students that live on campus or live surrounding campus during an emergency.
Great.
I also think you might find that reunification is the role of the American Red Cross.
So other agencies would be involved as well.
Yes.
Great. Dr. Troutman, we have a question specifically for you. Do you have any suggestions for health department staff engaging with grassroots community organizations who may have distrust with government or previous negative experiences?
So this is certainly not an overnight process, but one of the things that that works over time is being in the community as a vital support to the community's needs, to do that outreach with humility and putting your ego on the outside of the activity and not being involved as an egocentric individual. Understanding that the community has strengths just as they have weaknesses, and they need to be approached that way so that we're not constantly looking at a neighborhood or a population or a people and seeing only the negatives and the absence of the play on the strengths. Reach out to the positive nature of the communities. Communities, want to be opportunity communities. They want to have good transportation. They want to have good housing. They want to have good health status outcomes, etc. And if we think about those things that are basic to everyone and approach everyone in the same general manner, I think we get respect and we get involved and people begin to trust. Understand that the trust is not something that's been lost overnight, and it's not something that's going to be gained overnight. It's going to take time and effort. And again, people in the community need to see public health workers out in the community, attending meetings, offering expertise, providing insight into problems, listening. I often say one of the best ways that we as public health professionals can support those that we want to work with is to go into communities with big ears, meaning you should be listening more than you should be talking. And people will eventually warm up to you and tell you what the issues are. And a major part of that, of course, is listening to those community needs and not going in with preconceived notions as to what the issues are and what the population needs. I believe that works. I've seen it work over time. It's sometimes not the easiest thing to do because for some reason, as public health professionals, we still kind of sort of don't want to give up the notion that we know everything, and that's not the way to build trust in populations.
Great, thank you. Mr. Gardner, we have a question for you. You briefly talked about refugees. Can you talk a little bit more about what their vulnerabilities are and how we can address them?
Yes, the vulnerability for refugees as well as internally displaced persons, they don't have those local social supports. They may not be plugged in a network. They may not realize or appreciate what the hazards are in that community. The English may be a second language to them. They may have multiple issues or problems related to medical needs or care, and because they're not plugged into the system, their vulnerability can increase. We found that sometimes it takes executive orders or other things from the state in order to enroll individuals in agencies or organizations very quickly, and that seems to work in previous disasters, and that's everything from medication to schools to other social service programs that are needed.
Great, thank you. Another question, what approach should we take to determine where vulnerable populations are in our community?
This is Pat. I think one of the things is looking at other agencies and organizations that provide services to those vulnerable populations and finding out where those clients are. So if the local oxygen providers, they can certainly tell you where the oxygen-dependent individuals are. Those that work for Meals on Wheels or other home-based services can help you identify where those vulnerable populations are. Sometimes those individuals that are in the community know, and as Dr. Troutman said, it's going in with those big ears to say we want to understand and appreciate what resources are in the community, but also what the community is going to need, not only to bounce back, you want them to bounce forward after that event or incident. So many times the populations themselves or those that serve populations that are vulnerable will be able to tell you where they are in the community.
Thank you. Another question, can any of the presenters share best practices on systems regarding how to keep vulnerable population organizations' contact details consistently up to date?
I haven't.
Could you repeat the question, please?
Of course. Could any of you share best practices on systems regarding how to keep vulnerable population organizations' contact details up to date?
I can. One of our local communities, Sarasota County, the behavioral health providers, the agencies that provide behavioral health services in the communities got together, and each year they update a book that has the services and how to access referrals and other things. So they have that yearly update, but they also use that in a disaster or an event. They have bonded together as a group, so they're a strike team that if there's behavioral health issues or challenges in the community, as a group they decide what agency or organization it best fits into and who can provide those services. And many times those clients are already in services for the different agencies or organizations that are represented. So as part of their standard of practice, they update and refine the booklet every year, but they're in contact either on a daily or weekly basis, providing services to the community in non-disaster times.
This is Dr. Troutman. I just add 2 cents that, you know, as we go along doing our work, we should always be looking out for the populations who are at the highest risk based upon socioeconomic status, neighborhood safety, all the things that we talk about in social determinants. Invariably, they seem to be the same communities that need assistance because of the level of vulnerability. So any good public health practice ought to be regularly engaged in identifying populations that at risk based upon neighborhood and all the factors that we talked about, and working hand in glove with the emergency response for planning, disaster preparedness, etc., communities, to make sure that we're all on the same page and we know where the problems may be and which populations are the most vulnerable by virtue of their existing health status, health outcomes, and the social economic factors, the social determinant factors that we are beginning to understand better.
Thank you. Unfortunately, that is all the time we have for questions. I would like to now turn it back over to Gail for any concluding remarks.
Thank you, Rachel. On behalf of ASPPH and CDC, I would like to thank everyone for joining us today, with a special thank you to our presenters, Dr. Troutman, Dr. Tabler, and Mr. Gardner. The recording of this call will be posted on the ASPPH website at ASPPH.org within the next few days. As a reminder, today's webinar qualifies for 1 Certified in Public Health Continuing Education credit. To obtain your 1 CPH credit, please complete the webinar evaluation. You may access the webinar evaluation through the ASPPH.org website. Click Events at the bottom of the home page and you'll see the webinar description as one of the featured spotlights. Click on the spotlight and you'll find the link to the webinar evaluation. You can also visit shoppublichealth.org, shoppublichealth.org, and find evaluation under the Certified Public Health Continuing Education Credit section. The passcode that you'll need to include on the evaluation is USF PERL 2004. That's 2014. That's USF PERLC 2014. Please remember to report your participation in this webinar on the recertification and reporting systems as well. Thank you again for being part of today's ASPPH webinar, and have a great day.